Hello. I arrived in this country as a socialist. I grew up in a socialist country called Ireland. And I remember traveling with my uncle to see patients, and the only money that ever was exchanged was when he put his hand into his pocket and gave that patient or the adult in the family some money to go buy food for the new baby or get enough food so they could get healthy. He was my ideal of a doctor. I never saw money being exchanged. I was curious as a kid, and I would ask him, I didn't see you getting any money. He said, yeah, but I got potatoes and turkeys and chicken and carrots. What I didn't know, and I said that that's what he got. Because he was so understanding, he worked himself endlessly to give 4,000 people in my hometown the best primary care he could give them on a salary. He never had to ask people for money. He never had to deal with the dirty term, I would give it, I can't say here, of the lucre. It wasn't a part of healthcare. I came to this country, and the next thing I knew, I had all sorts of gorillas in my consulting room. And they were stealing all the money of healthcare. The insurance companies, you know, in some countries in the world, it's against the law for any private insurance company to sell healthcare. And I understand well why. I think most of us do. And so I struggled. I became a member of the Vermont Psychiatric, went to the assembly, talked about single-payer systems, and everybody just walked the other way. Like they were hopeless, lost, or lost their faith in themselves as Hippocratic physicians. What are we doing with insurance companies in our consulting room? What are we doing with technology eating up the dollar? What are we doing with chemicals that we give to our patients? We know that the pharmaceutical industry can sell anything, but a lot of it is lies. And it's time somebody took a stance and said, we are going to be in control. We need a single payer open system of healthcare where we can all work together and we don't have to be shoved into situations like I did recently with a man who I've seen for 20 years with severe dysthymia, recurrent acute depressions, with suicidal ideation, and in bad health physically. And he had lost his family through divorce, and he lost his business, and he was paying me all along privately when his insurance company had decided that he had a pre-existing condition. So is diabetes, so is hypertension, so are all the medical illnesses. But psychiatry, where we treat the engine room of our existence, which is related to every other single fiber in our body. And instead of having less, you know, when I came here, it used to be that we got 11-point-something% of the healthcare dollar. It's now down to 2%. Would you do that to the engine of your car? Would you throw all the money at the body and not care whether it moved or not? No. It's time that psychiatry got a better deal. And we think that can be through this single payer system. Another instance is that I'm now working partly voluntary, partly paid for an agency that deals with rehabilitation. I again emphasize all the things that have been said by a prior speaker regarding addictions. These patients have the worst of the social, the worst of the medical, the worst of the surgical, and also have 70% of them have mental problems. And again, I call and say, you can't let this person go out, they're suicidal. 5 days are up. And no matter how many hundreds of hours I spent on that phone, I never got one insurance company to okay rehab for addiction. Thank you.
Thank you.